तो आज हमारे साथ मिस्टर राजा मुखर्जी जी हैं और आप रहते हैं डेनमार्क में।
जी हाँ।
बड़ा ही सुंदर जो है कंट्री है। और आपकी प्रॉब्लम ये थी कि काफ़ी सारे दांत कुछ ख़राब हो गए थे, कुछ पहले ब्रिजेस लगे हुए थे, कुछ कैप्स लगी हुई थी, तो थोड़ा दांतों में इन्फेक्शन हो गया। फिर आपने मुंबई विजिट किया और मुंबई दिल्ली जो मेट्रो सिटीज़ हैं उसमें क्या हो रखा है कि कुछ लोगों ने चेन ऑफ डेंटल क्लिनिक्स खोली हुई हैं। सो द ओनर डोंट वर्क एक्चुअली, देर आर एक्चुअली द अपॉइंटेड डेंटिस्ट ऑफ वेरियस स्पेशलिटीज दे वर्क। और किसी डेंटल क्लिनिक का नाम नहीं लेंगे, लेकिन वो कोई बात नहीं। बट ये है कि आपके एक्सपीरियंस थोड़ा ठीक नहीं रहा, इम्प्लांट लगाए कुछ ये हुआ, तो ये था कि आपको फिर ये था कि मेरे को कुछ दूसरी जगह जाके थोड़ा तकलीफ भी हुआ, तो वो तो आप ही बताएंगे। फिर हमने कहा ठीक है आप आइए। एंड वी आर इन स्मॉल सिटी, आगरा इज नॉट अ वेरी बिग सिटी, दो इट्स वेरी फेमस फॉर ताजमहल एंड बिग टूरिस्ट प्लेस, बट वी कंसिडर इट small city in comparison to the Mumbai, Delhi or Bangalore, so people usually think that the patient whoever come to us, their relatives, their friends, they ask why you going to Agra for the treatment, so people think like it's a small place and we can't expect the dentist who can give you the better job than the dentist working in the metro cities. सो बट ठीक है, अब हमारे पास आपने देखा ये सब स्टेट से आते हैं, मुंबई से भी, दिल्ली से भी, सब जगह से आते हैं, यूरोप से के पेशेंट्स, यूएस से पेशेंट्स काफ़ी आते हैं, वो शुरुआत से आ रहे हैं। तो हमने आपको बोला कि आप आइए एंड वील ट्राई टू गिव यू द बेस्ट सर्विसेज, और हमारे पास कैड कैम सिस्टम सब चीज़ें हैं। तो हमने सर आपके जो आपके पुराने इम्प्लांट हैं उनको सब अनकवर किया, कुछ अपना इम्प्लांट लगा के आपको जो है ना कैप्स वगैरह कैड कैम से लगा करके और आपको दे दी। आपसे सर पूछना बस ये है कि आप क्या फील करते हैं, मुंबई, दिल्ली और द मेट्रो सिटीज they are better, or you can find a dentist at any place? You should look at the professional, कि आपको आपका अपना एक्सपीरियंस कैसा है?
I'll actually start from where you left.
Okay.
Why Agra?
Why Agra?
Okay. The first of all, I have been having this problem for many years.
Okay.
I think I can tell you at least more than 8-9 years, and I got treated myself in various places. That includes Copenhagen and Denmark.
Okay.
And last year, when I had gone to Bombay for my treatment, it was a major treatment, and as you know, there were 6 implants given. And as you correctly described, the clinic had many young junior doctors, and they all were doing their own thing. But there was no one coordinator which understand the entire sequence of the treatment.
Yes.
And in spite of many other things, it was a very nice clinic. Otherwise,
yes,
people are very well behaved, they are well educated. But I did not feel that somebody is taking responsibility to the end effect. So what is coming at the end? I should get the teeth of all clear, nice, and I can chew properly. So unfortunately, I didn't get that compliment. So therefore, first of all, I started studying myself. What is the next step? Where should I go? And I contacted my brother who lives in Delhi, and then we looked for some clinic in Delhi. But I had spoken to a couple of doctors, but I was not getting that confidence. I had, as you said, I had number of different issues, and that of course included the space available for fitting the crowns.
Yes.
Yeah.
That was a big challenge.
Big challenge. And there was a gap in between the two, implants, right?
Yeah.
And it needed especially a specialist hand. And and the normal sequence is, as we know, that you go to the doctor does these things, okay, then he takes a measurement. I've done many times, sends to someone which I don't know, they make the crown, and it comes out, they rub it somehow, they fit it in, you will like it, you will dislike it, but you got it.
Okay.
Yeah. So then I was looking for something which is I think I was not comfortable. Can I get something better? So when I started looking into internet, I found your YouTube channel, and through which I learned that you are able to do everything by yourself.
Yes.
Right from understanding the issue, finding a solution, and providing a right solution to the problem that I have. So very unique, very specific, and very to the people, to my needs. And that's what I thought. I don't care, Bombay, Delhi, Calcutta, or wherever it is, there are doctors everywhere. I need a treatment that really suits my needs. Okay? And that is one of the reasons I contacted my brother again, and he was very kind. I said, I know, in Agra, I know a doctor, and luckily, you are a very busy man.
Oh.
I could find time with you. Okay, and then and I'm very very happy that you not only found the solution to the problem, you actually you given me an implant where it was not given and that was needed because bone was, and you had the technique where you could give me an implant in the place where probably the other would have given me and asked me to stay another year to come back.
Yes.
And you immediately gave me the tape. And within time frame, I had a very short time frame, within a few days or few weeks, 2 weeks, and few days in those 2 weeks, you managed to give me the treatment. And I don't want to talk about the cost because, well, within the cost of the, whether I've got it in Delhi or Calcutta, doesn't really matter. I got the best treatment, and I like the way that you approach the problem. I like the way that you go in details. And I still remember I told the story to my relatives that last time that we talked, and you have been going back and forth trying to find a solution, and you came up with you told me that you have to give you another implant.
Yeah.
I said, oh, what? And they said, no, don't worry, I'll manage it at the time. So it was very, very nice. Thank you so very much, doctor. I'm really so happy to come here, and I hope that you will keep doing that. And another thing, I see how you treat other patients who have probably come from different backgrounds, social backgrounds, or financial backgrounds, and either no differentiation. I was telling my driver this morning that you treat everybody equally. That's so nice of you. You're such a nice gentleman. Thank you so very much. I'm very happy to find him, and I hope to keep in touch with you. And I hope to bring my wife sometime in future. She's also suffering because we are IGIC, so she's also suffering with the dental problems.
Thank you.
Thank you.
So, you're going totally in the comfort? Is there any pain, swelling, anything?
No.
Going home?
No, nothing so far.
You started chewing from the new teeth?
Last night I had a good dinner after a long, long time with full mouth chewing. So I really enjoyed my dinner last night, and this morning the breakfast, it was very nice.
You were bearing a removal, the processes.
Correct.
Over the implant.
Correct. Yeah.
In last almost 12-13 years, I have never given any removal process to any of the patient over the implants.
Okay.
Never. Because it, disturbed the implants. That's why you had a lot of bone loss over the implants.
Right.
And the removal process are not comfortable. So that's why I try, the immediate loading in most of my cases. You will see here, most of the patients are coming. So be giving the immediately even some, the processes which is temporary, but it is fixed over the implants.
I see, okay.
Or the processes which is permanently fixed over the implants. So in the full mouth cases, almost in the 99% of the cases, I would say the 100% of cases, left my clinic with the fixed teeth in 15 days of time, 10 to 15 days of time, and chewing everything over those implants. So we developed some techniques, how to anchor the implant into the high density bone. What is the right choice of the components to the angle those the implants so that we can give a teeth over the right position. So these are something because the CAD/CAM digital system, it helped us a lot. Since we started the CAD/CAM, the dentistry, it helped us because it's a combination. Some people are very good, even in India. I will appreciate their work. Some people are very good in placing the implants, but they are not able to actually give the right processes. Some people are very good in giving the right process. They have, some systems and their own labs and all that, but they are not able to place implant properly. So I concentrated, from the beginning. First, I developed my skills in placing the implants. Then I was also, 10 years back almost, I was also feeling little sort of when I sent to the laboratory, they were not doing the right job. Then we, established each and everything here in the clinic. We have another lab also, which is out of the clinic because there's some dust work and all that. So my technicians are working there. But everything we do ourselves in our supervision. So that's why, we are able to give you another better results. So thank you very much, sir. And
I just want to add this. This is exactly one of the reasons that I thought you are the person that I should go to because you make your teeth right here.
Yes.
Because I can see and you can also know exactly what is needed.
Yes.
You so end to end, right? From finding an issue, then sorting it out, and then creating what we call prosthesis, and then you give it back to and fitting it. So that is the one of the reasons that I should contact you and I should get my treatment finally from you.
Yes.
And that worked out very well for me.
Yes. When I'm placing the implant, I always have during the surgery have in mind where I'm going to fix the tooth. So like like any good architect, they always have in mind what kind of building they are going to have. It is not like we just place our pillars and after that we think okay अब इधर ये बना लेते हैं वैसे ही बना देते हैं. नहीं वो नहीं चलता. ऐसे इसमें है, आपको पहले प्रोसेस सोचनी होती है एंड अकॉर्डिंगली यू हैव टू प्लेस एन इम्प्लांट एट द करेक्ट प्लेस. तो लोग मिस्टेक ये कर देते हैं कि इम्प्लांट लगा लेते हैं, बाद में सोचते हैं कि चलो देखेंगे दांत अब कैसे लग सकते हैं, तो वहाँ थोड़ा सा मिस्टेक हो जाती है.
वो बड़ा अच्छा रहा एक्चुअली मेरे लिए एंड दैट वर्कड आउट क्वाइट वेल फॉर मी.
एंड ऑलवेज ट्राई टू गिव द कंफर्टेबल ट्रीटमेंट. पेशेंट कोई तकलीफ में न जाए, दर्द में न जाए, परेशानी में न जाए. और वो सर हैंड सेट हो गया, इतने इम्प्लांट लगा लिए, हजारों
इम्प्लांट आपने लगाया, मुझे कुछ भी पता नहीं चला. सो नाइस, वेरी नाइस.
चलिए सर, थैंक यू वेरी मच. ठीक है, और आपने हमें चुना, इधर आए आप, और आई एम थैंकफुल टू यू. दो आई एम सो मच ऑफ द लोड, लाइक अभी थोड़ा सा कम है बट बहुत लोड फिर भी बहुत रहता है. डे नाइट काफ़ी काम करना पड़ता है. तो लेकिन ये है कि होप सो आपका काम कंफर्टेबली हो गया, टाइम पर हो गया, और जैसा आप उम्मीद लेके आए थे वैसा हो गया.
बिल्कुल, बिल्कुल
सर, धन्यवाद आपका. और just go home and keep chewing whatever you want. Other people in the family, they are chewing, you can chew everything they are chewing.
So
okay?
Thank you.